A new national suicide and crisis lifeline is set to launch tomorrow with the goal of expanding mental health treatment in the United States. People will be able to call or text 988. Text or call 988. They'll be able to do that 24 hours a day, 7 days a week. They will connect with counselors for general mental health concerns and crises. The previous 11-digit national suicide lifeline will still work, but experts hope the shorter number will make care more accessible. Jeff Pegues looks at the benefits and the possible challenges.
A lot of people have these same concerns, and so I'm glad you called today.
This is an example of what you will hear when you dial 988. Starting tomorrow, it will become the new National Suicide and Crisis Hotline, an easy-to-remember lifeline for those dealing with mental health challenges and crisis in the U.S.
We are here 24/7, so we answer the phones all the time.
Erica Turner is the Chief Clinical Officer at Community Crisis Services, one of about 200 call-in crisis centers in the country.
If you're wondering, whether or not you should call, I think that's an indication that you should call.
More than 52 million people in the United States identified as having a mental illness in 2020, but only 46% received treatment. Meanwhile, the national suicide rate has jumped nearly 30% since 2000. Experts say the new 3-digit number will provide a simpler way to get emergency care. JAMEISON BRILL is the call center director.
Our workers work with them to process what's going on that's brought them to the crisis state that they're in, help them identify means of staying safe if they're having thoughts of suicide.
The 11-digit suicide prevention hotline takes in more than 3 million calls and messages a year. With the new 3-digit number, volume is expected to more than double by next July.
We want for people to know that it's okay to call. We want people to know that it's okay to, have feelings, to be in crisis.
But that expected increase in calls is fueling concerns of staffing and infrastructure shortages in several states. Former U.S. Surgeon General Dr. Jerome Adams.
We know for this hotline to be successful, people need not just an easy 3-digit number to call, but they need someone to actually answer that call, and they need resources to be able to refer individuals to. We know that's not in place in a lot of the United States.
The Biden administration and Congress are taking steps to help, increasing federal investments to $432 million, $282 million to scale up crisis centers nationwide, and $150 million as part of the bipartisan Safer Communities Act to amplify the new 988 hotline.
But if we don't build out the infrastructure and provide the funding for people to be able to get the services that they need, then ultimately this could be a failure moving forward, and we don't want that to happen.
One goal of the new number is to lessen the burden on 911 and provide an alternative for those fearful of involving police, as police officers are often not trained to deal with mental health crises. According to the Treatment Advocacy Center, people with untreated mental illness are 16 times more likely to be killed by law enforcement.
90% of the time, we're able to de-escalate the risk in the crisis over the phone.
Dr. John Draper is the executive director of the Mental Health Lifeline.
A person is in mental health crisis, getting an ambulance or getting a police response is not a calming sort of response. What many of them need is somebody to come to them who understands, listens, and helps them get to a safer place.
And so the hope is that 988, I have to get used to saying that number, works in tandem with 911, with trained counselors assessing the calls and then, if necessary, passing them along to emergency services or local crisis centers. And the goal is that police don't get involved only if there is a clear and present danger to somebody's life. Vlad.
988. Jeff, I like what Erica Turner said. If you are wondering about calling, it probably means that you should call for people that need help. Jeff Pegues, thank you very much, my friend. Appreciate it.